In the practitioner's field of work, confidentiality is very important. Confidentiality not only protects what the client shares, but also promotes trust in the relationship. Although similar, confidentiality and privacy are very different. Confidentiality refers to and protects personal information, whereas privacy refers to the freedom from intrusion into one's personal matters and personal information. Confidentiality between the practitioner and client means that the practitioner cannot share any information about the client with anyone else outside unless the information that the client shares will cause harm to themselves or others. Stigma is one factor that is associated with confidentiality. Some people find it hard to muster up the courage to see a professional. Some people know that they have a problem and need help, but they have heard from others that seeing a professional for their situation makes them appear weak. In other families, people think that seeing a professional and not talking about the situation within the family or family members only makes it worse because they are involving others and making the problem greater. As a practitioner, certain criteria needs to be upheld. One example of this is the practitioner has to be respectful, honest, and collaborative, and then this will provide a possible environment for the client and practitioner. Next, information discussed in a meeting with the client is not safe if it is sent by email, fax, etc., because anyone can read this, and if it is accidentally sent to someone else, then it is a breach of confidentiality. Another part of confidentiality is called informed consent. On the informed consent form, it mentions about what is going to be talked about, such as the goals and purpose of the session. An informed consent form is usually used for a minor who is under the age of 18. The parents of the minor and the minor have to read this form saying that they agree to everything on it, and then sign it saying that they abide by the rules. Other exceptions for the informed consent form is if the client does not speak or understand English well enough. The informed consent form will then be written in the client's main language for them to read, understand, and sign. If the confidentiality is broken between the client and practitioner, then it is called malpractice. Malpractice causes harm to the client, which can mostly be resolved in court. Some consequences of malpractice are loss of licensure, fine, and loss of reputation, etc. In accordance with confidentiality, HIPAA, or the Health Insurance Portability and Privacy Act, helps to keep the privacy of patient information. Confidentiality in groups, however, is different. even though the practitioner might suggest to the group that it is better for them not to disclose information out of the group. However, this cannot be guaranteed all the time. When the practitioner first meets the client, the practitioner has to uphold certain criteria. These are the duty to care, duty to respect privacy, duty to maintain confidentiality, duty to inform, duty to report, and the duty to warn. Confidentiality should be shared with the client at the first meeting. Duty to care means that the practitioner has to report if the client is in danger to themselves or others. Duty to respect privacy means that the practitioner cannot invade the client's personal space or force the client to tell more information than they are comfortable with. Duty to maintain confidentiality is abiding by the HIPAA laws and not sharing information that is considered private. Duty to inform means that the practitioner has to maintain constant contact with the client and tell them about what will be going on during each session. The practitioner will be explaining a little bit about their qualifications and how the client can either be benefited or harmed during the therapy that they are receiving by the practitioner. Duty to report means that if the practitioner suspects any abuse, they have to report it. Furthermore, each state has their own laws on child abuse, incest, molestation, and practitioners have to follow this and keep it in mind when seeing clients. Duty to warn means that the practitioner has the ability to let a higher authority know about confidentiality information during the sessions if she or he suspects or knows that the client will be harming another person. The only way that information can be shared with others is if a consent form is signed. This releases the information to any other people listed on the form. Each state has their own laws that determine the definition of a minor, so the practitioner must be familiar with the laws of the state in order to know what information to share with the parents or anyone else.